Hello friends, today we'll be talking about post-transplant care. So many of you who have got a transplant done now need to know how to take care of your transplanted grafts and your existing hair. So let's start from the day of surgery itself. The first and foremost thing, in which position do I sleep? Because many a time, especially a patient who has undergone an FUT surgery, they're scared of lying down on their back. You can easily lie down on your back or sideways. You have to start your antibiotics from the day of surgery itself, and generally a course of antibiotics is given for 5 to 7 days. There is a lot of tumescent anesthesia which is used. Because of that you have swelling. So what we do a bandage on the day of surgery. It helps the grafts to be in place and makes it a little safe. And then we put a bandage on the scalp so that the swelling doesn't come down to your eyes. The bandage is removed very next day, but the headband has to be kept for around 5-6 days. Now the swelling will remain above the band and it won't come onto your eyes. Now the next day, when you remove the bandage, make sure that you put some saline drops on the scalp in the recipient area. They provide nutrition to the grafts and they help in the graft sustenance. The care of donor area. You need to clean the donor area with betadine lotion, be it FUT or FUE in both the cases. Especially more important in cases of FUT, because along the stitch line there is scab deposition, so you need to clean it thoroughly. Now scabs are formed on the recipient side. Don't try to remove the scabs forcefully, they usually come out on their own. Very important question, when can you wash your head? You can wash your head on the third or fourth day of surgery with normal water, lukewarm water, and a mild shampoo. Now coming to the healing of donor area. Donor area in FUE usually heals by 5th day, and there is almost complete healing. But in FUT, the stitches are removed on 12th day. When can I resume? In most of the cases you have undergone either FUT or FUE, you can start running or other cardio exercises within a week's time. In case of FUE, by the end of second week, you can start vigorous weight training, anything you want. But in case of FUT, one has to be a little cautious, at least wait for a month. Now, how does the hair growth progress? The first phase is of growth phase, of where you see small tiny growth when the scabs fall. Usually that is in the first 15 days. Then the falling phase starts. All the transplanted roots, the hair shafts, they fall. And usually this phase lasts for around 2 to 3 months. This is the period when patients get annoyed or sometimes scared that hair is falling and it might not come at all. Don't get scared. This is normal. And the shaft is lost, the root still remains inside and the hair will grow. So usually by the end of third month, you start noticing regrowth of hair, and then it's just a routine natural growth. Though the number of hair and the thickness of hair would be less in the beginning, but as the time passes, the hair growth improves and the hair also improves in thickness. So usually most of the patients from 6 to 8 months period, that is the time when you see most of the growth. So how do I take care of my existing hair? This is really very important because transplanted hair are permanent, but transplant procedure doesn't help your existing hair. So for sustenance of your existing hair, you need to start the medicines. So usually I start the oral medicines, iodine and finasteride, 7 to 8 days after the surgery, once the antibiotic course is finished. And for minoxidil, I usually start minoxidil from the third week onwards. Sometimes patients can have some boils during the second or third month. This is very important. Sometimes people feel that this is because of some kind of infection. This is not an infection, this is called pseudofolliculitis. Some of the hair start ingrowing. There is no need to do anything, but still if it persists, you can apply some topical antibiotic lotions. It helps. And if it still persists, please contact your transplant clinic. Now there is a list of do's and don'ts. Most of the things I have already explained. But smoking is a strict no. During first 7 days, smoke post surgery, first 7 days, you have to avoid smoking. It has been seen it has been documented beyond any doubt worldwide that the graft acceptance is less in smokers as compared to non-smokers. So please don't smoke for 7 days, and it's good if you stop smoking. There are some medicines like blood thinning medicines you have to avoid at least for 7 days post surgery. Another important aspect of post transplant care is diet. So this is something which sometimes people neglect. There is a lot of blood loss during the surgery, so you need to have things which are rich in iron, like green leafy vegetables. Another important component of diet is protein. Make sure that the protein content in your diet is perfect. You can have eggs, you can have non-vegetarian food, you can have sprouts, you can have flex seeds, and there are so many things. Soya bean, paneer, tofu. You can add all these things in your diet. Last but not the least, hair transplant is such a beautiful transformation. You have taken a bold decision. Believe in it. Be positive. Your hair growth will come. Positivity really brings the best out of your hair transplant. So be positive about your transplant. Keep your fingers crossed. I hope the information in this video will be helpful, and to have more informative videos, please subscribe my YouTube channel if you haven't already subscribed. Don't forget to press the notification button for regular updates. You can also follow me on Facebook and Twitter. I wish you best of luck and best of the hair growth, and may all your hair dreams come true. Thank you. Love yourself. Stay blessed.